So good morning to all of you. Good morning to all of you. I'm Dr. Pradeep Pawar. Once again with some MCQs and some images for you all. High topics. Okay, let us start. See the first MCQ. Yes, students. Anyone? Answer this. A chronic alcoholic was diagnosed with pseudocyst of the pancreas. The pancreas is a retroperitoneal organ. Okay, pancreas is a retroperitoneal organ, students, correct. Any other retroperitoneal organs that we know of? Yes, any other retroperitoneal organs? You can answer this, be interactive, so it will be easy for you to understand and for me to teach. So which are the other retroperitoneal organs? One, the kidneys, the suprarenals, kidneys, the suprarenal glands, the duodenum. The entire duodenum is retroperitoneal except a small area of the first part and a small area of the fourth part. They are intraperitoneal. So the list of retroperitoneal organs, one is the kidney, suprarenal, duodenum except a small area of the first and the fourth parts, pancreas, ascending and descending colon, aorta, IVC and the ureters, aorta, IVC and ureters. So that's a list of retroperitoneal organs. Are you following this? Kidneys, suprarenal, duodenum, pancreas, ascending, descending colon, aorta, IVC and the ureters. So that's the list of retroperitoneal organs. So pancreas is also a retroperitoneal organ. All the following statements about the pancreas are true except answer option 1. Tail contains the maximum islets of Langerhans. What do you say? Yes, tail contains the maximum islets of Langerhans. Yes. And the tail of the pancreas lies in what? The lienorenal ligament. Correct? The tail of the pancreas lies in the lienorenal ligament. And the tail contains the maximum islets of Langerhans. And when we are removing the spleen while doing a splenectomy, we have to be very careful because when we are cutting the lienorenal ligament, the tail of the pancreas has to be preserved. Otherwise, if the tail of the pancreas is gone, the person goes into diabetes mellitus. Diabetes mellitus. Yes. Left crus of the diaphragm is posteriorly related to the body of the pancreas. Can anyone tell me what are the posterior relations of the body of the pancreas? The posterior relations of the body of the pancreas is the aorta with the origin of superior mesenteric artery. Aorta with the origin of superior mesenteric artery, the left renal vein, left crus of the diaphragm, left renal vein, left crus of the diaphragm, left kidney, left suprarenal, and yes, and the splenic vein. Very good. Splenic vein. Very nice. All of you answering. Very good. So these are the posterior relations of the body of the pancreas. Remember, students, plenty of MCQs you get on the pancreas. So aorta with the origin of superior mesenteric artery, the left renal vein, the left crus, the left kidney, the left suprarenal gland and the splenic vein. So what is the dorsal pancreatic bud form? The dorsal pancreatic bud forms the upper part of the head, neck, body and the tail of the pancreas. The upper part of the head, neck, body and the tail of the pancreas. That is formed from the dorsal pancreatic bud. The ventral pancreatic bud forms the lower part of the head and the uncinate process. The lower part of the head and the uncinate process is derived from the ventral pancreatic bud. Okay? So the dorsal pancreatic bud forms the upper part of the head, neck, body and tail of the pancreas. The ventral pancreatic bud forms the lower part of the head and the uncinate process. Students, ये किसका duct है? What is this duct of? This is the duct of the dorsal bud, and this is the duct of the ventral bud. That's the duct of the ventral bud. ठीक है? So that's a duct of dorsal bud and that's a duct of ventral bud. Now, how's the main pancreatic duct formed? Can anyone answer this? The main pancreatic duct is derived from the duct of the dorsal bud. Here. That's the duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. So this becomes the main pancreatic duct. The duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. So this becomes the main pancreatic duct. And what does this become then? This becomes the accessory pancreatic duct. Clear? So the uncinate process drains via which duct? Can you answer this? The uncinate process drains via the main pancreatic duct. It's not accessory pancreatic duct. Following. So the uncinate process of pancreas, it drains via the main pancreatic duct. Look at this. That's the main pancreatic duct. The main pancreatic duct is also known as, can anyone answer this? The main pancreatic duct is also known as the duct of Wirsung. And where does it open into? The major duodenal papillae. It opens into the major duodenal papillae 8 to 10 centimeters from the pylorus. The accessory pancreatic duct is known as the duct of Santorini. And where does this open? This opens at the minor duodenal papillae 6 to 8 centimeters from the pylorus. Minor duodenal papillae 6 to 8 centimeters from the pylorus. I hope this is clear to all of you. So uncinate process drains via the accessory pancreatic duct into the duodenum is wrong. Ye clear hai? So accessory pancreatic duct drains via the uncinate process of pancreas drains via the main pancreatic duct. Splenic artery supplies the pancreas. Correct. If you can tell me, students, where is the splenic artery related to the pancreas? Where? To which part of the pancreas is the splenic artery related to? Yes, anyone? Can anyone answer this? The splenic artery is related to the body of the pancreas, the superior border of the body of the pancreas, and it gives branches to the pancreas. Name the pancreatic branches. These are the pancreatic branches. Fine. So answer is C for this. Answer is C for this. Any doubts anyone has? You tell me. Okay. So very good. So answer is C for this. Right. Coming to the next MCQ. Yes, students. Superiorly to the body of pancreas, that's correct. Now answer this. What is this black pointed structure and what is this blue pointed structure? What is the one in black? This is a section. This is a horizontal section of the brain. Horizontal section of the brain. Can anyone identify this first? Ye kya hoga? This structure, this is the corpus callosum. Ye corpus callosum hai, ye bhi corpus callosum hai. So what is this part of the corpus callosum? This would be the genu of the corpus callosum. Genu. And what is this going to be? This is going to be the splenium of corpus callosum. So genu and splenium. Can anyone tell me what is this structure? Anyone? Yes. What is this structure? Yes. What is this structure? This is the septum pellucidum. What is this structure? This is the fornix. Yes. So that's the corpus callosum. That's the septum pellucidum. That's the fornix. What is this black colored structure? Very good. That's the caudate nucleus. You got that right. That's the caudate nucleus. And what is this structure? This one. What is this structure? That's the thalamus. Ye caudate nucleus hai, ye thalamus hai. Caudate nucleus, thalamus. And now students, if you can tell me this. What is this? That's the lentiform nucleus. This is the caudate nucleus. That's the thalamus. That's the lentiform nucleus. Can anyone tell me what is this cavity here between the two thalami? Ye kya cavity hoga? What is this cavity between the two thalamus? Yes, students. The two thalamus. The thalamus and hypothalamus encloses a cavity between them. Name of the cavity. Yes. The thalamus and hypothalamus encloses a cavity between them. What's that? The third ventricle. That is the third ventricle. Yes, very good. You got this right. That's the third ventricle. And what is this cavity? Can anyone tell me? Ye kya cavity hoga between the caudate nucleus and this septum pellucidum and the fornix? What is that cavity? I marked it in red. That's the lateral ventricle. Are you getting this? ये है lateral ventricle, that's the third ventricle. Fine, perfect. Perfect, very good. And now you tell me, students, what is this V-shaped structure? What is this V-shaped structure? Can anyone answer this now? And this is now going backwards. Chalo, this is the internal capsule. Internal capsule. What is this limb of the internal capsule? Anterior limb. What is this? Genu. What is this? Posterior limb. अब ये क्या होगा? This is the retrolentiform part. Retrolentiform part, and the part will go below the lentiform nucleus. Lentiform nucleus के नीचे जाएगा. What is that part known as? The sublentiform part. So this becomes the retrolentiform part, and the part below the lentiform nucleus would be known as the sublentiform part of the internal capsule. Sublentiform part. Quickly, students, can you tell me retrolentiform part contains what fibers? What fibers are present in the retrolentiform part of the internal capsule? I just want that important fiber present in the retrolentiform part. Anyone? The important fiber present in the retrolentiform part of the internal capsule. Students, bolo. What is that fiber which is present in the retrolentiform part of internal capsule? Anyone you can guess? Yes, that's the optic radiation. Very good. You got this, optic radiation. So optic radiation passes through the retrolentiform part of the internal capsule. ये याद रखना. Auditory नहीं है, that's optic, because it is going to the occipital lobe. That's how you remember. Yes, Rishi, it is going to the occipital lobe, so that is how it will be optic radiation. So optic radiation passes through which limb of the internal capsule? Retrolentiform part, and the part which will go below the lentiform nucleus. Lentiform nucleus के नीचे, what do you call this as? The sublentiform part. Which lobe is it going? नीचे मतलब नीचे meaning temporal lobe. So what fibers would the sublentiform part carry? Only the important fibers I am asking. Auditory radiation. Very good. So sublentiform part, it will be the auditory radiation. Excellent. Very good. Okay, so be interactive, so it will be easy. What fibers are present in the genu? I just want the important fibers. Genu. What are the fibers which are passing to the genu of the internal capsule? Can anyone answer this? I want the important fiber which passes to the genu of the internal capsule. They begin from the cortex. These fibers would begin from the cortex and they would end in the brainstem. They would end on the nuclei of the cranial nerves. ये क्या fibers होंगे? The corticonuclear fibers. Yes, Jack, that's the corticonuclear fibers, or the corticobulbar fibers we call them as. Yes. And what are the fibers which are passing through the posterior limb of the internal capsule? Another very important fiber. The fiber begins from the cortex and the fiber ends in the spinal cord, on the anterior horn cell of the spinal cord. And these fibers are the ones which call as corticospinal fibers. So corticospinal fibers, yes, pyramidal tracts or the corticospinal tracts passes to the posterior limb. The corticonuclear fibers pass to the genu. The optic radiation passes to the retrolentiform part, and the auditory radiation passes to the sublentiform part. Bas itna, this much at least you should know. Perfect. Very good to all of you. So very nice. You've identified everything. The cortic nucleus, the thalamus, the lentiform nucleus. You've identified the lateral ventricle. You've also identified the third ventricle. Perfect. Very good. Right. Can anyone tell me what is this part of the lentiform nucleus? The outer one. This is the putamen and this is the globus pallidus. The putamen and the globus pallidus. Okay, so that's the putamen and that's the globus pallidus. Now, if you can just tell me, students, the caudate nucleus and the putamen, they form a single unit. What is that? The caudate nucleus and the putamen, they form a single unit. Can anyone answer this? Anterior limb में frontopontine fibers जाते हैं. Anterior limb ऋषि frontopontine fibers, हाँ, frontal lobe से pons, frontopontine. हाँ, students, tell me, caudate nucleus plus putamen, what is that known as? That is known as the striatum. Second is the globus pallidus. globus pallidus. Third is the substantia nigra. And the fourth is the subthalamic nucleus. Subthalamic nucleus. What is this that I have written for you? What is this that I have written for you? Okay. So the caudal nucleus plus putamen known as striatum. Second is the globus pallidus. Third is the substantia nigra. And the fourth is the subthalamic nucleus. Students, this together makes what? This together forms what? Anyone? Come on, answer. This you must be knowing. That's the basal ganglia. Very good. This is the basal ganglia. And this basal ganglia is responsible for planning and programming of the movement. And the basal ganglia is going to project on which area of the cerebral cortex? Can anyone answer this? This basal ganglia is going to project on which areas of the cortex? The areas which are concerned with planning and programming of the movements. Who's that? Which area of the cortex does this basal ganglia project on to? Anyone? Answer. Bolo. You got my question now. Basal ganglia is concerned with planning, programming of movements, and this basal ganglia is going to project on to which area of the cortex? Cerebellum nahi. Not cerebellum. That's area number 6. Area number 6, which we call as the premotor. Premotor area. Premotor area. That's area number 6. And this basal ganglia is going to project onto this area number 6, right? So which is concerned with execution of movement. It actually carries out the movement. जो area number 4 है ना, that is only initiating the movement. It initiates the movement. The area number 6 actually carries out the movement, and this is controlled by basal ganglia. That is responsible for execution of movements. Premotor areas. Area number 6. I hope this is clear to all of you. Very good. Very good. Chalo bachon, we go to the next MCQ. Here we go. A 40-year-old male comes to the clinic with complaints of loss of taste sensation. Loss of taste sensation. Listen, wait. Before you go further, loss of taste sensation. Tell me, anterior 2/3 of the tongue, taste sensation, who carries? Anterior 2/3 of the tongue, who carries the taste sensation? Before proceeding further, answer this. Anterior 2/3 of the tongue. Who carries taste sensations? That's chorda tympani. Posterior 1/3 of the tongue. Posterior 1/3 of the tongue. Who carries taste sensations? That's the glossopharyngeal nerve. So this is 7th nerve. This is 9th nerve. And the posterior most part of the tongue. Who carries taste sensations? So anterior 2/3 is the chorda tympani. That's a branch of facial. Posterior 1/3 is the glossopharyngeal, and the posterior most part is the vagus. That's an internal laryngeal branch of vagus, and the fibers from this the fibers of facial nerve, the fibers of glossopharyngeal, and the fibers of vagus, now they go to a nucleus. Can you name the nucleus? What is this nucleus which receives this taste sensations? What is the name of the nucleus? Come on, students, you can answer this. What is the name of the nucleus in the brain which receives the taste sensations from the tongue? Guess? Yes, very good, Rishi. That's the nucleus of tractus solitarius. Perfect, very nice. That's the nucleus of tractus solitarius. And from this nucleus of tractus solitarius will begin a tract. A tract will begin, and this tract will go to the thalamus. Okay. From the nucleus of tractus solitarius will begin a tract which will go to the thalamus. Anyone knows what is the name of this tract? Nucleus of tractus solitarius से एक tract बनेगा जो thalamus की तरफ जाएगा. The name of the tract is solitary thalamic tract. Solitary-thalamic tract. And this solitary-thalamic tract will be going to the thalamus, and from the thalamus, which nucleus of thalamus is this? Which nucleus? Which nucleus of thalamus? Bolo, jo aata hai wo bolo, students. I'm here to correct you. Don't retract your messages. That's okay. So which nucleus of thalamus is this? That's the ventropostromedial nucleus of thalamus. Ventropostromedial nucleus of thalamus. And then from the thalamus, the fibers would go to the cortex. Okay, from the thalamus, the fibers would then go to the cortex. Is this clear? So, the taste sensations from the anterior 2/3 are carried by chorda tympani, which is facial. Posterior 1/3 is glossopharyngeal. Posterior most part is the vagus. And the fibers from all these three nerves would be going to the nucleus of tractus solitarius, which is located in the medulla. From this nucleus of tractus solitarius would begin a tract named the solitariothalamic tract, which will go to the thalamus. Which nucleus of thalamus? Ventro-postero-medial nucleus of thalamus. And the fibers then go to the cortex. Understand? So just in brief, I've told you this. Right, so 40 years old male comes to the clinic with complaints of loss of taste sensation. On examination, patient was not able to appreciate the taste sensations in the posterior 1/3 of the tongue. Now we are knowing this. This is glossopharyngeal nerve. Yes, posterior 1/3 matlab glossopharyngeal. Rest sensations of the tongue are intact. The neurologist concluded the involvement of glossopharyngeal nerve. One of the following statements about glossopharyngeal nerve is correct. Answer this now. Supplies the stylopharyngeus muscle. क्या बोलते हो? Does the glossopharyngeal nerve supply the stylopharyngeus? What do you say, students? Come on, be interactive. Answer. Does the glossopharyngeal nerve supply the stylopharyngeus muscle? Yes, that's correct. Why? Because the stylopharyngeus muscle is formed in which pharyngeal arch? Stylopharyngeus muscle is formed in the third pharyngeal arch. Yes, and which is the nerve of the third arch? Glossopharyngeal nerve. It's the glossopharyngeal nerve. So yes, the glossopharyngeal nerve does supply the stylopharyngeus muscle. It supplies the stylopharyngeus. And if you can quickly tell me what is the name of the nucleus of the glossopharyngeal nerve, students, to supply the stylopharyngeus? मतलब ग्लॉसोफैरिंजियल नर्व का एक स्पेसिफिक न्यूक्लियस होगा ब्रेन स्टेम के अंदर टू सप्लाई द स्टाइलोफैरिंजेस. कैन एनीवन टेल मी द नेम ऑफ द न्यूक्लियस ऑफ ग्लॉसोफैरिंजियल नर्व? यस, अद्वैत कदम, व्हाट इज द नेम ऑफ द न्यूक्लियस ऑफ ग्लॉसोफैरिंजियल नर्व? क्या लिखा है? ग्रेटर पेट्रोसल नर्व लिखा है? नहीं, नो. व्हाट इज द नेम ऑफ द न्यूक्लियस ऑफ ग्लॉसोफैरिंजियल नर्व? एनीवन, कम ऑन, ट्राई बच्चों, कम ऑन, ट्राई. You can crack this option. What is the name of the nucleus of the glossopharyngeal nerve which is going to supply the stylopharyngeus muscle? वैसे ये common nucleus होता है for the 9th, the 10th and the cranial accessory nerve. This is a common nucleus, and this common nucleus is going to supply the muscles of the 3rd arch, 4th arch and 6th arch. I've given you काफी hints. Very good. That's the nucleus ambiguous. Remember all this, huh? ये सब याद रखना. So what is the name of the nucleus of glossopharyngeal nerve to supply the stylopharyngeus? That's nucleus ambiguous. Attached to the brainstem between the pyramids and the olives. क्या बोलते हो? What do you say? Attached to the brainstem between the pyramids and the olives. क्या बोलते हो? I've got a slide for you. Look at this. So this is the midbrain. Look students, ये midbrain है, that's the pons है, and that's the medulla, right? That's the medulla. What is this in the medulla? Pyramids है ना, ये pyramids है. What is this? This is the pyramids here, this is the olives here, and that's the inferior cerebellar peduncle. Pyramids, olives, and the inferior cerebellar peduncle. Tell me, which is the nerve between the pyramids and the olives? What is this nerve? That's the 12th nerve, hypoglossal nerve. The nerve between the pyramids and the olives is the hypoglossal nerve. The nerve between the olives and the inferior cerebellar peduncle. Olives and the inferior cerebellar peduncle is 9th, 10th and 11th. 9th, 10th and 11th. Yes, perfect. Very good to all of you. Very good. Excellent. You're answering well. So, which is the nerve between the pyramids and the olives? That's the hypoglossal nerve. Where is the glossopharyngeal nerve attached? It's between the olives and the inferior cerebellar peduncle. So, attached to the brainstem between the pyramids and olives is wrong. It's wrong. It's between the olives and the inferior cerebellar peduncle. Olives and inferior cerebellar peduncle. Contains no general visceral efferent fibers. What do you say? क्या बोलते हो? What is the general visceral efferent fibers supply? The general visceral efferent fibers are going to supply the parotid gland. The general visceral efferent fibers are going to supply the parotid gland, and yes, glossopharyngeal nerve has got this general visceral efferent fiber. So contains no general visceral efferent. This is wrong. It's wrong. Glossopharyngeal nerve supplies the parotid gland. Yes, and what are the fibers? That these are the general visceral efferent fibers. And students, can you tell me the name of the nucleus of the glossopharyngeal nerve which is going to supply the parotid? The name of the nucleus of glossopharyngeal nerve which is going to supply the parotid gland. Anyone? The name of the nucleus of glossopharyngeal nerve which is going to supply the parotid. That's the inferior salivatory nucleus. Inferior salivatory nucleus. Very good. Inferior salivatory nucleus. That's the nucleus of glossopharyngeal nerve which supplies the parotid. Now, passes between the middle and the inferior constrictors. What do you say? Is this right or wrong? Passes between the middle and the inferior constrictor muscles. क्या बोलते हो? The glossopharyngeal nerve goes between the superior and the middle constrictor. Superior and middle constrictor. Superior and middle constrictor. The glossopharyngeal nerve goes between the superior and the middle constrictor muscles of the pharynx. It doesn't go between the middle and inferior. Superior and middle constrictor. Can anyone tell me who goes between the middle and inferior constrictors? Who goes between the middle and inferior constrictor muscles of the pharynx? Can anyone answer this? Anyone? Middle and inferior constrictor muscles of the pharynx. What passes? Bolo, bolo, bolo. What passes between the middle and inferior constrictor muscles of the pharynx? The internal laryngeal nerve and superior laryngeal vessels. Between the middle and inferior constrictor muscle passes the internal laryngeal nerve and superior laryngeal vessels. Okay. Is this clear? Yeah, MCQ clear hai? Internal laryngeal nerve and superior laryngeal vessels. Very good. Very good to all of you. बच्चों, ये MCQ clear है to all of you? Perfect. Very good. See the next MCQ. So answer is A. Answer is A for this. A is correct. A is correct. Okay. Answer this. A 60 years old woman complains of bitemporal loss of vision. Bitemporal loss of vision. What is that known as? A bitemporal hemianopia. Bitemporal hemianopia. When do you get this? कब मिलता है ये bitemporal hemianopia? When the optic chiasma is compressed. The center of the optic chiasma where the fibers are going to cross. The nasal fibers जहाँ पे cross होता है ना, nasal fibers where they cross, if there's a tumor of the pituitary gland and if the tumor is compressing the nasal fibers and the optic chiasma, the person is going to get what? A bitemporal hemianopia. Bitemporal hemianopia. Okay. Examination reveals a bitemporal hemianopia. MRI reveals a pituitary tumor compressing the optic chiasma in the region of interpeduncular fossa. This you must be knowing, no? Bitemporal hemianopia, compression of the nasal fibers, ये आपको पता होगा. Okay, all the following structures are related to the interpeduncular fossa except. Okay, just let me draw this for you. Interpeduncular fossa, another very important MCQ is this. Interpeduncular fossa. Okay, have a look. I'll just make this for you. This is the optic nerve, bachcho, that's the optic nerve, that's the optic chiasma, and this is going to be the optic tract. Optic tract. Yes, this is the optic nerve, this is optic nerve, this is optic chiasma, and this is the optic tract behind. Now, if you can quickly tell me, what is this? This is the crus cerebri. Crus cerebri is a part of the midbrain. That's the pons. Ye midbrain hai, matlab crus cerebri is a part of the midbrain. That's the pons. And that's the medulla. Ye medulla, what is the first elevation in the medulla known as? Pyramids. Pyramids. What is the next elevation in the medulla known as? Olives. Olives. And what is the third elevation known as? The inferior cerebellar peduncle. Inferior cerebellar peduncle. This is the middle cerebellar peduncle. Middle cerebellar peduncle. Now, if you can quickly tell me, students, what is this? View. कहाँ से देख रहे हो ये? Where are you looking this from? bolo. Where are you looking this from? What is this view of the brain? Can anyone answer this? Students, come on. This is a view from below, inferior view, inferior surface of the brain, inferior surface. Now, if you can just quickly tell me what are these? This area है interpeduncular fossa. ये जो आप देख रहे हो, this area is the interpeduncular fossa. So, students, quickly tell me what are the boundaries of interpeduncular fossa? Whose anterolateral is the optic tract, है ना? Anterolateral is the optic tract. Posterolateral is the crus cerebri. Posterolateral is the crus cerebri. What is this now? The floor is formed by the pituitary stalk, the mammillary bodies, and the posterior perforated substance. Pituitary stalk, the mammillary bodies, and the posterior perforated substance. And you'll be getting a nerve here. यहाँ पे एक nerve मिलेगा, nerve. I'm just drawing it in red. The nerve is third nerve. And you get this circle of Willis here, circle of Willis. Okay, third nerve and the circle of Willis will be the contents. Contents is the third nerve and circle of Willis. ठीक है? So that's the content. Are you all clear? So boundaries, anterolateral, and just write this for you. Anterolateral is the optic tract. Posterolateral is the crus cerebri. The floor is formed by pituitary stalk, mammillary body, and the posterior perforated substance. I'll show you the slide. Posterior perforated substance, and the contents would be the third nerve and the circle of Willis. That becomes the contents of interpeduncular fossa. I hope this is clear to all of you. बच्चों, अगर कुछ clear नहीं है तो बोलो हाँ. See, ये जो area ना, this area is the interpeduncular fossa. So anterolateral is the optic tract, posterolateral is the crus cerebri. The floor is formed by the pituitary stalk, the mammillary bodies, and the posterior perforated substance. The contents are going to be the third nerve and the circle of Willis. Now there's no place for me to draw the circle of Willis there. Okay, done. I'll show you the slide. See this slide. Look at this slide. Same slide, yeah? Yep. So tell me, students, what is this now? What is this? This is the optic tract. What is this? This is the crus cerebri. So ये जो area आप देख रहे हो, this is the interpeduncular fossa. What is this? This is the pituitary stalk. This is the mammillary bodies, and that's the posterior perforated substance. And what is this nerve? That's the third nerve and circle of Willis होगा इसके अंदर. Third nerve and circle of Willis. Is this perfect? Clear to all of you? Okay. So what is the answer for this MCQ that we were looking at? Answer this. A 60 years old complained, so all the following structures are related to this fossa except. What's your answer for this? Fourth nerve. The fourth nerve is not a content of interpeduncular fossa. Fourth nerve is not a content. It comes from behind. ये पीछे से आता है. It's not a content. Clear to all of you? Done. So crus cerebri is a boundary, mammillary body and posterior perforated substance. These are in the floor. Floor में होते हैं ये interpeduncular fossa के. Fourth nerve is not there. See the next. Answer this, students. What is this structure? What is this black pointed structure? And what is this blue pointed structure? Can anyone answer this? What is this black and blue? What is this section of the brain? बोल सकते हो? What section are you looking at? ये क्या view है? This is a sagittal section of the brain. No, this is a coronal section. Sagittal नहीं है ये coronal section है brain का. Coronal section. ये है choric nucleus. This is a choric nucleus. ये होगा thalamus. Choric nucleus and thalamus. Can anyone tell me what is that black arrow? The black arrow. And the black arrow is the internal cerebral vein. internal, that's a coronal section. Cavernous sinus nahi hai bacha. Jack, that's not cavernous sinus. The one in black is internal cerebral vein. Internal cerebral vein. This one and this one. I'm just putting a black arrow on this side also. Ye dono and both of this are internal cerebral veins. And students, how are the internal cerebral vein formed? The internal cerebral veins are formed by the joining of three veins. I'll just put numbers here and I'll put number here. Number one is the septal vein. Septal vein. You can see this writing, no? Septal vein. Number one is the septal vein. Number two, I'll just put number 2 here. Number 2 is the choroidal vein. Choroidal vein. And this choroidal vein drains the choroid plexus. Ye choroid plexus ko drain karta hai. And number 3, you can see this number 3. Number 3 is the thalamostride vein. Thalamostride vein. So I put 3 numbers here for you. Very good, very good. Number 1 is the septal vein. Number 2 is the choroidal vein. And that red and a red is the choroid plexus. And the choroidal vein is going to drain the choroid plexus. It drains the choroid plexus. So septal vein, choroidal vein, and number 3 is a vein between the thalamus and the caudate nucleus. Between the thalamus and the caudate nucleus, therefore known as the thalamostride vein. Thalamostride vein. Now, 2 internal cerebral veins joins to form the great cerebral vein. This is the great cerebral vein. This is a great cerebral vein of Galen. Okay, so the black is the internal cerebral vein. 2 internal cerebral veins joins to form the great cerebral vein of Galen. I hope this is clear to all of you. And what is this vein? Ye kya ho sakta hai? Students, if you can tell me what is this vein which is draining into the great cerebral vein of Galen? This is the basal vein. Basal vein. The basal vein comes and drains into the great cerebral vein of Galen. That's the basal vein. Ye clear hai bachcho? Is this clear? Any doubts? If you have, you let me know. So look here. 2 internal cerebral veins joins to form the great cerebral vein of Galen, and the 2 internal cerebral veins are formed by the joining of 3 veins, one thalamostride, choroidal and septal. Clear? That's it. Fine. I hope this is clear to all of you. Okay, you can just answer this MCQ. A 10 years old boy was playing with his friends. Fine, he was playing with his friends. A pointed object hit him on the side of the face. There's something pointed object comes and hits him on the side of the face here. On examination, a small wound was found in the region of the parotid gland. Ek chota sa wound ban gaya in the region of the parotid gland. 6 months later, the boy notices that just before meals, he used to sweat profusely on the facial skin close to the healed wounds. After 6 months, he found that yahan se sweating hota tha. Yahan se sweating hota tha. The following statement can explain this, correct? This except. Okay, you can tell me what has happened here. This is, what is this? This is the perforating lesion of the skin over the parotid gland. Perforating lesion. Perforating lesions of the skin over parotid gland. क्या होता है इसमें? Parotid gland. That's a perforating lesion of the skin over the parotid gland. There is mixing of 2 fibers. The fibers of auriculotemporal nerve. The fibers of auriculotemporal nerve gets mixed with the fibers of greater auricular nerve. Greater auricular nerve. And the fibers of greater auricular nerve supply what? Sweat glands. They supply the sweat gland, and the auriculotemporal nerve is going to carry the fibers to parotid gland. carry secretomotor fibers. They carry the secretomotor fibers to parotid gland. अब ये देखना, I have written everything for you. So now, when there's a lesion of the skin over the parotid gland, इसे हम बोलते हैं perforating lesions of the skin over the parotid gland. When the regeneration is going on, when the wound is getting healed, there's a mixing of two fibers. There's a mixing of fibers of two nerves. One is the greater auricular nerve, and the second one is the auriculotemporal nerve. The auriculotemporal nerve is carrying the fibers to the parotid gland, and the greater auricular nerve is also going to supply the sweat gland. So there's a mixing of the fibers. So now when a person starts to salivate, the person starts to get sweating of the skin over the parotid gland. What is this known as? This is the Fraze syndrome. This is Fraze syndrome. Okay. This is clear. That's Fraze syndrome. And quickly tell me, students, which is the cranial nerve which supplies the parotid? Come on, students, answer this. Which is the cranial nerve supplying the parotid? I've just told you this. Which is the cranial nerve supplying the parotid? Answer this. The glossopharyngeal nerve. Glossopharyngeal nerve. It's the glossopharyngeal nerve. And what is the name of the nucleus of the glossopharyngeal nerve to supply the parotid gland? What is the name of the nucleus of glossopharyngeal nerve? That's the inferior salivatory nucleus. Okay, I'll just make this for you. Inferior salivatory nucleus. That's the nucleus of glossopharyngeal nerve. It's tympanic branch. Tympanic branch of glossopharyngeal nerve. Very good. What is that known as? Jacobson's nerve. I'll just write this down. Jacobson's nerve. It forms the tympanic plexus. Tympanic plexus. From the tympanic plexus we get the lesser petrosal nerve. Lesser petrosal nerve. The lesser petrosal nerve comes and relays in the otic ganglion. It relays in the otic ganglion, and the fibers will go to supply the parotid gland. The fibers will go to supply the parotid gland. And what are these? Who carries these fibers? This is carried by the auriculotemporal nerve. This is carried by the auriculotemporal nerve. Okay. The students, tell me, if you can quickly tell me, where is this located? ये कहाँ पे है? This is in the brainstem, है ना? ये brainstem में है. This is in the brainstem. From the brainstem to this ganglion. From the brainstem to this ganglion, what are these fibers? Preganglionic fibers. What are these fibers? Postganglionic fibers. Postganglionic fibers. So who's going to carry the postganglionic fibers from the otic ganglion to the parotid gland? These are carried by auriculotemporal nerve. This is what I want you to understand. Okay, so these are the preganglionic fibers. Begins in the inferior salivatory nucleus. The preganglionic fibers for the parotid gland begins in the inferior salivatory nucleus, and the postganglionic fibers from the otic ganglion are carried by auriculotemporal nerve. I hope this should be clear to you. Have a look at the MCQ once. Look at the MCQ. The pointed object entered the parotid salivary gland and damaged the parasympathetic secretomotor fibers of the gland. Correct? Yes. So the pointed object which has hit on the side of the face has entered the parotid gland and damaged the parasympathetic secretomotor fibers. Yes. The preganglionic fibers arise in the superior salivary nucleus. This is wrong. The preganglionic fibers arise where? In the inferior salivatory nucleus. Inferior salivatory. The superior salivatory nucleus is supposed to supply what? It's a nucleus of which nerve? Facial nerve. Superior salivatory nucleus is a nucleus of facial nerve, and it supplies the rest of the glands of head and neck. The rest of the glands other than parotid. Parotid chode ke. It supplies the other glands. The skin over the parotid gland is innervated by greater auricular nerve, which is also damaged. Correct? The patient has Fraze syndrome. Correct. Is this clear to all of you? Yes, very good. Right. Coming to the next MCQ then. So the answer for this is B. B. Answer is B. Yes, coming to the next MCQ. If you can identify this pointed structure, bachcho, pointed structure. This is a very important MCQ, very important MCQ. Identify the pointed structure. Anyone? एक मिनट, which aspect of the ankle is this? Can you tell me? I'll help you to identify. Rishi, tibialis anterior nahi hai. Tibialis anterior is the muscle in the anterior compartment. Tell me which aspect of the ankle is this? Which is this aspect of the ankle joint? Why did you retract the message? Don't retract the messages. Kuch nahi hota. Tell me which aspect of ankle is this? Come on, students, bolo. Which is this aspect? This is the medial aspect of the ankle. Medial aspect of the ankle. This is the medial malleolus. है ना? ये medial malleolus है. This is the calcaneum. What is this now? What is this that I'm shading? This is the flexor retinaculum. Flexor retinaculum. And deep to the, जैसे ये flexor retinaculum होता है, flexor retinaculum, and these are the carpal bones. What is the tunnel here deep to the flexor retinaculum? What is the tunnel deep to the flexor retinaculum? That's the carpal tunnel. ये है carpal tunnel. So what is this tunnel? That's the tarsal tunnel. Tarsal tunnel. So students, what are the structures which are passing through the tarsal tunnel? What are the structures passing through the tarsal tunnel? The first one. The first muscle is tibialis. I'm so sorry. The first muscle is tibialis anterior. Okay, here we are. So the first muscle is tibialis anterior. Tibialis anterior. Tibialis anterior. Behind the tibialis anterior is the flexor digitorum longus. Flexor digitorum longus. Then is the posterior tibial artery. Posterior tibial artery. Then is the tibial nerve. Tibial nerve. And the last one is the flexor hallucis longus. Flexor hallucis longus. Just remember this. Sequence है anterior to posterior. Anterior to posterior. Anterior to posterior. So structures passing through the tarsal tunnel. Okay, these are the structures which pass through the tarsal tunnel. These are the structures which pass through the tarsal tunnel. Anterior to posterior. Anterior to posterior. The first one, tibialis posterior. I'm so sorry, bachcho. Tibialis posterior hai. Posterior. I'm so sorry. Tibialis posterior. I'm so sorry. Tibialis posterior. Yes, tibialis posterior. Then comes the flexor digitorum longus. Then is the posterior tibial artery. Then is the tibial nerve. And the last one is flexor hallucis longus. Is this clear to all of you? So these are the structures which passes. So suppose if this comes as a visual slide. Bachcho, if this comes as a visual slide and if this is pointed the way I have pointed for you. अगर ये point किया है, without looking at anything, just identify this as tibialis posterior. Identify this as tibialis posterior because you should know the structure which winds around the medial malleolus. The tendon which hooks around the medial malleolus is tibialis posterior. The structure which winds around the medial malleolus is tibialis posterior. Fine, that's it. Coming to the next MCQ. Okay, coming to the next MCQ, students. But before I come to this MCQ, let me brief you about our platform. Just one more MCQ is left. Don't leave. Wait. Now, we've got a plus subscription in which there are daily live classes, live quizzes, learning from the top educators, study from the device of your choice. And now, students, you can access the question bank too. An iconic subscription with this best of Unacademy and pre-planner for you. A special class features in which there is daily live classes, poll for the learners, never miss a class with proper notifications being given. Okay, raise a hand technique in which if you press the icon you can directly talk to the educator. Suppose if you miss the class, you get the lecture notes in the form of PDF, and anytime, anywhere, students, you can attend these lectures and get your doubts solved. A highly effective and updated question bank has been prepared with detailed explanatory answers specially for you. And these are our NEET PG toppers. The last NEET PG, they've got very good ranks. So we congratulate all of them. Once again, raise a hand technique in which if you press the icon, you can talk to the educator. And this is actually a very good app. This is a very good... I've answered on this. The students can talk to the educator. Some rituals. Now we've got specific tests on specific days. Students, be there to give this test. These are free tests. So we've got this educator curated test series, subject wise test on Wednesday 9 p.m. FMJ Grand Test Series, Wednesday 9 a.m. and 2 p.m. Study with me, the YouTube Test Series, Friday 9 p.m. Special Marathon Class-Based Test Series on 9 p.m. Saturday 9 p.m. and we have got a grand test for all our courses across on Sunday 9 a.m. So we're starting with 2 new batches, a Focus FMG Comprehensive Batch 2022 from 29th of December. Okay, I'll take Arpita, and I'll take a class on this. Target NEET PG 2022 MCQ Discussion Batch on 29th of December. Download the Unacademy app and subscribe to it. Histology boulder. I'll take this. I'll take the class on histology, don't worry. Fine, students, come to this. Answer this MCQ. A 46-year-old man was involved in an automobile accident and sustained a tear of capsule of the carpometacarpal joint of the right thumb. In view of history of a lung disease, it was decided to repair the laceration under a brachial plexus nerve block. The orthopedic surgeon decided to inject the anesthetic into the brachial plexus below the clavicle. All the following statements regarding the brachial plexus are correct except... Okay, chalo, you can answer this. Just before that, you tell me which part of the brachial plexus lies below the clavicle. Can anyone tell me which is that part of the brachial plexus below the clavicle? Students, answer this. I take free lectures. These are some special classes also, free lectures for anatomy. I take 8 a.m. in the morning and 3:30 a.m. in the evenings also. There are special classes. Okay. Special classes are free classes. This is 8 a.m. in the morning and 3:30 p.m. in the evenings. Today is Friday, Saturday, Sunday. So morning 8 o'clock I have taken, 3:30 in the evening I'll be having a class. Tomorrow and day after tomorrow also. Okay, just see to it that you attend this class. Yes. So which part of the brachial plexus is infraclavicular? The roots, the cords and the nerves are infraclavicular. Cords and nerves are below the clavicle. Which part of the brachial plexus is supraclavicular? The roots, trunks and divisions. So roots, trunks and division clavicle के ऊपर होता है. They are supraclavicular. So answer this. The brachial plexus is formed by the anterior primary rim of C4 to T2 spinal nerves. That's wrong. It is formed from C5 to T1. C5 to T1. Normal brachial plexus is formed from C5 to T1. If C4 takes part in the formation of brachial plexus, what do you call this as? Prefixed. If C4 takes part in the formation of brachial plexus, it is known as prefixed. If T4 takes part, it is known as postfixed. It is known as prefixed and postfixed. Clear. The axillary sheath is formed by the deep fascia and surrounds the axillary vessels and the brachial plexus. All the following statements are correct except the axillary sheath is axillary sheath is formed by the deep fascia and surrounds the axillary vessels and brachial plexus. Actually, this is partly correct and partly wrong. If it would have been a multiple answer MCQ, I would have taken this also as wrong. This also I would have taken as wrong. But if you have to select a single best answer, A hoga. A is the answer. What is wrong in B? Anyone, if you can tell me what is wrong in option B. What is wrong in option B? Let me see if you can answer this. Anyone? What is wrong in option B? Something is wrong. I'm telling you, something is wrong. Abhi bolo na. I'm telling you, something is wrong. Okay, tell me, this axillary sheath है ना, which fascia of the neck is it derived from? Can anyone tell me? Axillary sheath is derived from which fascia of the neck? Dr. Neetu, wait, I'm telling you. Which is that fascia of the neck which comes down into the axilla and surrounds the brachial plexus? That's a prevertebral fascia. So the prevertebral fascia from the neck comes down into the axilla and surrounds the. It encloses the axillary artery and the brachial plexus. Bachcho, it is not axillary vessels. Axillary vessels nahi hai. It is axillary artery and the brachial plexus. समझ में आ रही है? It is not vein. The axillary vein is outside the axillary sheath. Remember this. Axillary vein is outside the axillary sheath. Why? Because the axillary vein has to bring more blood. Suppose अगर ये axillary vein brings more blood, the axillary vein has to distend. It has to distend. तो उसको distend होने के लिए it needs to have a space. There. Yes. So axillary vein is outside the sheath. ये clear है? So who encloses the axillary sheath encloses what? The axillary artery and the brachial plexus. Vein nahi hota. And the axillary sheath is derived from which fascia of the neck? The prevertebral fascia. The cords are placed according to the names in the second part of axillary artery. That's correct. So the cords are placed in which part? Cords are placed in the first and the second part of the axillary artery. Cords are present in the first and the second part of the axillary artery, and the cords are placed according to the names in second part. The cords are placed according to the names in the second part. इसका मतलब the cord which is lateral in the second part is lateral cord. The cord which is medial in the second part is the medial cord, and the cord behind the axillary artery in the second part is the posterior cord. So the cords are placed according to the names only in the second part. First part may be cords होते हैं, but they are just randomly placed. They are not placed according to the names. They are randomly placed. Ulnar nerve is a branch of medial cord. Correct. Ulnar nerve is a branch of medial cord. Can anyone tell me the root value of ulnar nerve? Can anyone tell me the root value of medial cord? Yes, बच्चों बोलो. What is the root value of medial cord? What is the root value of medial cord? बोलो ना. Answer something. कुछ तो बोलो. What is the root value of medial cord? The root value of medial cord is C8 and T1. C8 and T1. Root value of medial cord, देखो, medial cord का root value क्या होता है? C8 and T1. C8 and T1. And ulnar nerve is a branch of what? Ulnar nerve is a branch of medial cord. Okay, it's a branch of medial cord. So ulnar nerve का root value should have been what? C8 and T1. Ulnar nerve का root value should have been C8 and T1, but ulnar nerve का root value is C7, C8 and T1. Ulnar nerve का root value is C7, C8 and T1. This C7 fibers arise from lateral cord. ये समझ में आ रहे? Medial cord का root value क्या होता है? C8 T1. Ulnar nerve is a branch of which cord? Medial cord. So ideally ulnar nerve का root value should have been what? C8 T1. But ulnar nerve का root value is C7, C8 and T1. अब ये C7 fibers कहाँ से आते हैं? The C7 fibers arise from lateral cord. This is what I am telling you. The C7 fibers comes from lateral cord of the brachial plexus. Okay, I hope this is clear to all of you. Ulnar nerve is a branch of medial cord. Which are the other branches of medial cord? One is the medial pectoral nerve. Second is the medial root of median nerve. Third is the medial cutaneous nerve of arm. Fourth is the medial cutaneous nerve of forearm. And the last one is ulnar nerve. Okay, I hope this is clear to all of you. Anything else? कोई doubt है तो बोलो. If you have any doubts, you tell me. I hope all the MCQs are clear and a lot of concepts gets cleared with this MCQs, and it's very good that you are interactive. So the more you interact, the more I can go into details and I can tell you. Okay, fine. It was a very nice session. I enjoyed the session. Thank you to all of you once again. And yes, I'll take a lecture on histology also. Some important, as slides project करेंगे, and you just try to identify the slides and we'll discuss the identifying points of the slides. That's very important. Some very important slides will project. Okay, so next time let us have some discussion on histology. Thank you. I hope this is clear to all of you. Thank you to all of you. Thank you, my dear children. Thank you. कुछ डाउट्स नहीं है ना? थैंक यू, बाय बाय.